stop being around the bush. Hey, let's get it on. Get it on. You know what I'm talking about. Come on, baby. Hey, let your love come out. If you believe in love, let's get it on. Oh, let's get it on, baby. This minute, oh yeah, let's get it on. Please get it on. I know you know what I've been dreaming of. Don't you, baby? My whole body wants to get in a love. I ain't gonna worry. No, I ain't gonna push. I won't push, baby. Woo! Come on, come on, come on, come on, come on, darling. Stop being around the bush.
All right, come on. Let me say good, is it good evening, I guess? It's good evening. I've got Mayor Pro Tem Dave Martin with me, and Chief Pinion, and the Chief Medical Officer of the city, Dr. Purse, and Major Zach Bell with the Salvation Army, and a number of people that are with me today. Look, good evening to everyone, and thank you for joining us. I know it's later than what this press conference would normally be, but there were a number of mayors from across the country that was on a call with President-elect Biden and Vice President-elect Kamala Harris today, and that was this afternoon right around 2 o'clock. And then after that, I had a meeting with a number of the big city mayors in the state of Texas discussing a number of topics, some of which we're talking about today. So that delayed us quite a bit. I'm also joined by, again, Dr. Purse, Chief Pena, and Mayor Pro Tem. In just a few days, families across our city, state, and country will gather to give thanks for the many blessings we have experienced. But it goes without saying that Thanksgiving Day is going to look and feel a lot different than in previous years, and it should. Because of the coronavirus. It is not safe for people to gather in large groups or to sit down at the table with people outside of their immediate households. And remember what we've said many times, we don't want to invite COVID to your Thanksgiving table. The virus is still spreading and hospitalizations are increasing. And I want you to know every day that I've looked at them, our numbers have gone in terms of hospitalizations from the low 400s and then 500s, then the 600s and the 700s, and now it's in the low 800s. So the numbers are steadily creeping up, and we need to be mindful of that. I cannot stress enough that the numbers are moving upwards. The positivity rate for this week is 8.8% in the city of Houston. That is up from last week's 7.9. So this week it's at 8.8. And let me ask for your help. I need your help in helping us to blunt that curve from going up, if nothing else, to stabilize it, and then to work to start bringing it down. But the number is going up, and it's going up pre-Thanksgiving. And so that's why we are encouraging people this Thanksgiving season to resist the temptation to come together in large groups, large gatherings, especially family gatherings. That is not in anyone's best interest right now. The Houston Health Department reports 463 new cases of COVID-19 bringing Houston's total count to 93,988. We're also today reporting 3 people who have died from COVID-19, and that will bring the city's total to 1,417. I will say, as of today, we're still in a manageable situation of this virus. But as you know, this virus can go from 0 to 60 real quickly. And therefore, we're asking people to be mindful of your behavior, be mindful of who you're going to be hanging out with over the next several days, and join with us to blunt the progression of this virus. Right now, I'm not even asking for it to go down to 5%. I'm just asking us to keep from raising the positivity rate up, just to blunt it right where it is, and then let's start working to bring it down. Until we get a vaccine, our mask is our vaccine. This one right here, that's the vaccine. We must continue to mask up, social distance, wash our hands frequently, and get tested. To reinforce the message, today I'm announcing the launch of a new and second Mask Up commercial. Last time, we used some star athletes and a rapper. And this time, I have a little help from my friends, all of the mascots from our Houston area sports teams, along with Denzel Washington. Denzel will be the one in the apron. Let's see if we can get Denzel and the others to join us.
We need to be mindful of everyone's health and safety when planning family gatherings. Make a plan and share it with your guests. Get tested at one of the many free testing sites within the city. Continue to be vigilant. Wear your mask, wash your hands frequently, and social distance so you can enjoy your time together with peace of mind. Protecting our loved ones is the most important thing for all of us. Mask up, Houston. We're better together. When planning family gatherings, be prepared, get tested, wash your hands frequently, and social distance. Protecting our loved ones is the most important thing for all of us. Mask up, Houston. We're better together.
Al planear tu reunión familiar, prepárate. Hazte la prueba del COVID, lava tus manos con frecuencia y mantén distancia social. Proteger a nuestros seres queridos es lo más importante. Enmáscarate. Houston, somos mejores juntos.
All right. We want to thank those Houston mascots, and we want to thank Denzel for appearing in that commercial. No charge, I might add to that. And then I want to thank Susan Christian and her team for directing and producing. So thank you, Susan Christian, for that. And that's Susan, our own. So a lot of talent right here at the city of Houston. I want to thank all the Houston Texans, the Houston Rockets, and the Houston Dynamos and Dash for loaning us their mascots to assist with the campaign to encourage Houstonians to continue to safeguard themselves from potential exposure to COVID-19. Quickly, before I bring up Dr. Purse, who will talk more about the vaccination protocols, and Chief Pena also will talk about what's happening in his shop, I want to welcome our friends from the Salvation Army and mention the Red Kettle Challenge Day. Since 1889, the Salvation Army of Greater Houston has provided the services of feeding, sheltering, emotional and spiritual care, substance abuse programs, child care, and emergency disaster relief to those who need the help the most in our communities. This year, with social distancing rules in place, the Salvation Army's iconic red kettles, we expect to see a sharp decline in donations due to decreased foot traffic at grocery stores, malls, and other brick and mortar institutions this Christmas season. The devastation caused by this downturn will be felt by not only the organization, the Salvation Army, but also those that they serve. This includes the homeless, the hungry, the abused, the addicted, and the forgotten. The Salvation Army is predicting a 155% increase in need this season. That's 155% need increase. They need our help to serve our neighbors in the city. So the Salvation Army has launched their Red Kettle online and has challenged the community to help them rescue Christmas, unquote, for those in need. And though we haven't been able to partake in some traditions, ringing in the season with the Salvation Army's red kettle is something we wanted to give the community. Today, I'm presenting a proclamation to Major Zach Bell, and I am honored to officially ring in the season. Ring in the season and proclaim that the fourth Friday of every November marks the start of the red kettle season. And so with that in mind, Major Bell. Let me take this opportunity to present to you the Red Kettle Challenge, this proclamation, and in part it reads, therefore I, Sylvester Turner, Mayor of the City of Houston, hereby proclaim November 27, 2020 as Red Kettle Challenge Day in the City of Houston. Thank you all for what you all continue to do. I want to have some few remarks.
I won't take long. I'll just say this. I just want to thank Houston in advance for what you're going to do, because we believe that the city of Houston, we are a community who rallies around those in need. We see that need each and every day at the Salvation Army. Just know that that bell ringing is a call that we can come and help and serve those at their greatest time of need. Thank you so much. God bless you, and Merry Christmas on behalf of the Salvation Army.
Thank you. I kind of like this bell. All right, don't forget the Salvation Army. So many people rely on them for their support, and even though the foot traffic may not be as great as it has been in previous years, the need is even greater. 155% increase in need this year. So again, when you see the kettle, or go online, and if you see the kettle, please give. And if, for example, if you hear me ring the bell, that means donations are accepted, okay, to the Salvation Army. Now, at this point in time, let me call on Dr. Purse, the Chief Medical Officer for the city.
Thank you, Mayor. As the Mayor pointed out, the numbers that we're seeing are increasing daily. And as he also pointed out, we monitor those numbers on a daily basis. We get them both from the Texas Medical Center as well as from StetTrack, which looks at it on a per county basis. So we, of course, pay close attention to Harris County. Now, I believe there's a chart that's coming up. No? Okay. Well, anyways, the Mayor talked about it. You could see on the slide that he showed earlier, you could see that the numbers were rising. Now, one of the things that I want to point out in that slide is the numbers that are rising now, if you go back and you look at late June, then you would see that, well, you can see here that the numbers are going up. Our positivity rate is going up. Now, our numbers are not where we were a while back. We're higher than this, but the movement is in the same wrong direction. I also want to point out that the height of those yellow and red bars indicates the number of people who are getting tested. And I want to thank Houstonians, because the number of folks getting tested is up a little bit over 60% just in the last few weeks. So people are responding, and this is really good for the reasons we've said many, many times. One is it gives us better insight into what's going on in the community. Number two, for the people who get tested, if you should be one of the 40 or more % people who are infected and don't have any symptoms, and therefore you wouldn't have any way to otherwise know, once you've tested and you find out you're positive, you are now in a position where you can protect your family from the virus that you are unknowingly carrying. So the fact that more people are going tested is really, really great, and we're glad to see that. And it's also, unfortunately, it's showing that the virus is spreading, and the numbers are going up. We're at 8.8%, which is not a small number. When we talk about across Harris County and the number of hospitalizations that are occurring, the number of hospital beds that are currently occupied with patients diagnosed with COVID disease has risen to over 10%. It's now 10.4%. So that's a threshold we hope that we would not meet. You may recall that the governor has set a threshold that for a trauma service area, and for us it's a 9-county region, if it gets about 15%, the rules sort of change at the state level. So from the state level, you know, they're seeing 15%. We are unfortunately, we're on track to hit that if we don't change something. So we need to take advantage of the time we have now to start driving these numbers down again. 10.4% is very high. I believe we were down as low as 6% several weeks ago. And then in terms of the vaccine, the mayor pointed out we're going to be talking about the vaccine. We're expecting that there will be vaccine coming out in the next several weeks. We're unclear as to exactly when that's going to be. You have to wait for some decisions to be made at the federal level. But when they will be sent out, they're going to be prioritized. And the governor today issued a statement illustrating the priorities that have been set at the state level in terms of what the philosophy will be as to how that vaccine will be. Remember, in the beginning, we'll probably have less vaccine than there are people who are wanting it. And so we need to prioritize that. So the number one, you can see the priorities that are here that are listed on this slide. These come from the governor's task force. And number one will be protecting healthcare workers, but in particular, these are healthcare workers who are in the practice of caring for COVID positive patients. Not just any and all healthcare workers, but those that are in hospitals taking care of COVID patients and the immediate support personnel who are involved in the care of patients who currently are diagnosed with COVID disease. Also going to be looking at vulnerable populations. We're looking at other frontline workers who are at increased risk because of what they do. So I want you to picture the people who work on ambulances that are going to be transporting COVID patients, the vulnerable populations, and then of course, going beyond specific populations, talking about the process will be once we're going to look to mitigate health inequities. These will be data-driven decisions. There will be some appropriate geographic diversity. And then there's going to be transparency on the part of all of the, to the public of all the allocations. This is the priorities set forth by the governor. And we are fortunate that our own Stephen Williams, the director of the city's health department, was on a committee that helped with this. As the vaccine becomes available locally, it will be first sent to hospitals because the number one priority here, as I mentioned, is going to be healthcare workers in the practice of caring for COVID patients. It will also be going to some of the other, as more vaccine becomes available, go to some of the other usual vaccination sites. So with that, I want you to start thinking of your primary care physicians' offices. I want you to think of the fairly qualified healthcare center clinics, things along those lines where vaccines are normally made available. The Houston Health Department will serve our role that we always serve as being that safety net provider so that we'll be able to provide vaccine to those who have no other way of getting it. And again, we'll be prioritizing those communities that have increased risk and less availability due to all kinds of healthcare inequities. And so we're very familiar with where those neighborhoods are, but we'll also be monitoring where the virus activity is at any given time and try to prioritize those neighborhoods. To that end, in getting vaccine out in the community, we, the Houston Health Department, have been working with providers across the region. We have already identified 333 Houston healthcare providers, which are identified as COVID vaccine providers. And we've been working with Harris County. There's another 250 vaccine providers within the county that are already registered to participate in the vaccination program. And in the meantime, however, I want to remind folks that until you become vaccinated, and remember the vaccines, most of them, it's a two shots. Until you get vaccinated, it's actually a week after your second dose that you would be able to consider yourself. And this is going to take a while. Until then, we all need to continue wearing our masks, washing our hands, remaining physically distant, and doing all the things that our mascots are showing us how to do, and protecting ourselves just as we have been. Here.
I know there'll probably be a few questions coming back to you, Dr. Purse. Chief Pena.
Thank you, Mayor. Good afternoon, everyone. I'm going to provide a quick update on the fire department's quarantine numbers, and then I will do a Spanish translation on what Dr. Purse had just mentioned and what the mayor relayed earlier. The quarantine numbers for the Houston Fire Department today are, we have 125 firefighters that are in quarantine. We've had, since the pandemic began, we've had 340 firefighters that have tested positive for coronavirus. 296 of those have since returned to work. Currently, we have 43 firefighters that are in quarantine. As we expect the holiday season coming up, and especially Thanksgiving, I want to remind our community of just a few safety reminders, especially cooking and frying reminders. Okay, fried turkeys are delicious. They really are. You can fry a shoe and it'll taste good. So turkeys are even better. But I want to remind the public that it is very dangerous if you do it improperly. Please follow the proper directions. Make sure the turkey is fully thawed and dried before you dip it into that hot oil. Do not fry your turkeys inside your home, your garage, or on your deck or under the eaves. They have to be away from the home, please, away from the home and outside. So that's a quick reminder, but every year we see a number of fires resulting from cooking accidents. The If you can put the slide back up, what the doctor had, the summary of the governor's order, and I'll summarize that in Spanish real quick. So, en español, el alcalde Turner avisa a nuestra comunidad que en estos días de Acción de Gracia, que tengan precauciones, especialmente del contacto del coronavirus. Si esperan familiares que lleguen de otras partes, que limiten el número de personas que estén en sus casas. Les recomendamos que se hagan sus pruebas del coronavirus, que son gratuitas y pueden hacerlas esta semana para que estén preparados para poder celebrar seguramente. Y lo que el gobernador ha dado ahora son estamos esperando la vacuna del coronavirus. Esperamos que llegue en un mes o 6 semanas, pero el gobernador ha puesto las prioridades de estas vacunas a las personas que van a recibirlas. Primeramente, la van a recibir los trabajadores que están en los hospitales, son la primera prioridad. La segunda prioridad son para proteger los trabajadores sanitarios, más bien los que están en las ambulancias, aparte de los hospitales. También proteger los trabajadores de primeras líneas. Y la siguiente prioridad son proteger las poblaciones más vulnerables en nuestra ciudad. También la siguiente prioridad es asignar las vacunas basadas en datos y tener transparencia al público en la asignación de estas vacunas. Se van a recibir vacunas limitadas, pero lo que recomendamos a nuestra comunidad es hasta el tiempo que lleguen las vacunas y puedan vacunarse, que la mejor recomendación es seguir los guías de prevención, usar las mascarillas, mantener su distancia física y mantener una higiene apropiado para poder prevenir el contagiarnos con este virus. Así es que vamos a esperar a contestar preguntas después de que hable el alcalde. Gracias.
Muy bien, that was very good. And you covered all of those points that I wanted you to cover. Left out one or two things, but I'll amplify that a little bit later on. And then speaking on behalf of City Council, let me call on Mayor Pro Tem to just amplify the safety message, because of this Thanksgiving, it could be either good or it can be very alarming for us after Thanksgiving. So Mayor Pro Tem.
Thank you, Mayor. If your family is a traditional family like mine, you have someone coming home from college. Hopefully they were tested before they came home, because we made ours do that as well. And I know that our traditional Thanksgiving trip to another city isn't going to happen. So the important thing, this vaccine is on the horizon, and everybody needs to understand that. So we have just a couple of months to get through this tough time period. So make sure we all wear our masks, social distance, and do the proper hygiene. Even though we have Thanksgiving, which is a very, very focused on the family type of holiday, I'm especially concerned with the numbers that you see in the deaths with the Hispanic community, because we know La Familia, very family oriented. So for this time, let's step back a little bit and let's make sure we put in the proper protocols to keep everybody safe, because we don't want any more deaths in the city of Houston. So last thing, happy Thanksgiving and God bless.
Thank you, Mayor Pro Tem. Before we open for questions, I want to acknowledge that there has been a lot of discussion about Houston area schools seeing an increase in student failing grades as a result of COVID-19. I'm very concerned from that, coming from and still living in an underserved community, and kids that are falling behind as a result of COVID and the virtual learning. We have monitored the reopening of schools across the city and have found that a campus environment is one of the safest places for our most vulnerable, historically underserved student population. A student school is often the only place where students can feel safe from other environmental factors that impact their learning at home. They receive critical wraparound support services, food access, counseling, tutoring, and more. Beyond these essential services, school district leaders have indicated that about 40% of students are failing at least 2 core classes, compared to about 7 to 8% we would see in a typical school year. A significant contributing factor to this across the board decrease in student performance becomes apparent when a child is not able to attend class in person. And many of our students, especially those who are low income or need additional educational support services, perform much worse online. I'm reminded of when I was in school. Neither one of my parents graduated from high school, and quite frankly, they were not able to assist me in my homework when I got home. I can only imagine parents who may find themselves in a similar situation, and kids as well. And that is why what I've indicated to Dr. Purse and to others, let's do everything we can to support our schools, our school districts, to make them as safe as possible so that many of our kids can continue to get in-person learning. That's critically important. Otherwise, this virus will not only put them further behind now, but it will impact their lives down the road. This necessitates our schools being open for students who need the most help getting back on track. Of the COVID-19 cases we have seen in our schools, most of the persons infected were exposed to the virus outside of school. Our educational leaders have gone to great length to keep the inside of school buildings as safe as possible by requiring masks, social distancing when possible, ramping up cleaning and sanitation services, and implementing holistic safety measures to respond to any potential virus need. Their dedication to safety has made our campuses safe, and we want to continue to support them every way possible for our kids, for our teachers, cafeteria workers, bus drivers, you name it. But this virus has created a great deal of challenges, and its impact has just been unmeasurable. And the fact that many of our kids are falling behind is highly disturbing. And so we want to provide as much support to our districts, to our schools, to our parents, teachers, support staff, and to our children, because to the extent they can have in-person learning, that is in their best interest, and quite frankly, it's in all of our best interests for today and for tomorrow. So let's continue to provide that needed support to them as they continue their in-person learning as much as possible. Having said that, we will take any questions or comments that anyone may have.
We're going to start with the pool, Tori, followed by Channel 13 and Channel 2. Is that part of the agreement?
First question is to you, Mayor.
Sure.
How did today's discussion go with the Vice President-elect?
Yeah, it was a very good session. The very fact that even before he sworn in, that he would take the time to meet with many of the mayors across the country. Many are from the U.S. Conference of Mayors. I'm one of the trustees, and so he met with almost all of the trustees as well as some others. It was quite frankly an opportunity to ask both the president-elect and as well as the vice president-elect some questions. There were 5 mayors who asked questions on behalf of all of us. So I thought that was quite informative. He did indicate a willingness to work directly with mayors on an ongoing basis. He recognized that we're on the front line, recognized the needs that we are facing from vaccinations to infrastructure to climate change, the economy. All of those things came up, housing, education, those ways they were very positive. So I thought it was a good start and look forward to continuing to work with him.
Were you able to address Houston specifically? And if so, what did they talk about?
Not today. Houston didn't come up specifically today, but I can tell you just based on other conversations that there will be some additional conversations. I have been in communication with the transition representative Houston has been assigned to that particular person. So I've talked to that person several times over the last couple of weeks, and look forward to continuing those conversations. Look, we want to do everything we can to make sure that Houston is on the map, and when they're implementing their policies, that Houston is kept front and center in their minds.
For the GRB Turkey Fest, is there going to be anything different for the people receiving food, and also is there going to be anything different for the people
Talking about the
preparing food?
Superfest, the
Yes,
Superfeast is scheduled for this coming Thursday. Citywide clubs, Bishop Woodard. I think the difference this time, a major difference, instead of there being served hot meals, because every year, my daughter, myself, and so many other thousands of volunteers, but they're serving them. I think this time it's going to be a pick up and go, similar to what occurred at the NRG this past weekend. There will be where people can walk up and take food with them, or they can drive through. So that will change from the hot meals. It will be different, a much safer way of distributing or meeting people's needs this year.
And is there any donations or anything still needed from the community?
With that super feast, they literally feed anywhere from 20 to 25,000. I'm sure Bishop would be here. He would tell you they are still in need of turkeys and all of the canned goods and all of the things that go right along with providing the Thanksgiving meal. And I say that because just today, separate and apart from the city-sponsored food distribution that Susan Christian and Shannon Bugs and the HER Task Force and HEB and all of the other sponsors did on Saturday, just today alone, I participated at three different food distributions just today on the south side as well as on the north side. Each one of those locations, the lines were long. So there are tremendous needs even in our city. And we're not going to be able to meet all of those needs. But let me tell you what I'm glad you asked the question. Let me tell you what I'm thankful for. I'm thankful for the fact that so many people and businesses have been willing to share what they have with people who are less fortunate than themselves. So much so that literally thousands of families in the Houston region, that their needs to some degree are being met. So I'm very, very thankful for that.
Next question is for Dr. Purse.
Not exactly sure what that means, but did I get my wings?
The question is, it's been nearly a week since Harris County sent out a public alert to all residents urging them to get tested for COVID. What kind of traffic have you seen at the test site since then? And what do the results tell you from that?
Yeah, so this is what we were talking about before, and the mayor put out an alert as well. So with that graph, we saw there's been a steady increase. I wouldn't say there's necessarily a jump after the judges, but that was a good thing that she put that out. But we have seen a steady increase in people getting tested. And at the same time, we've seen the positivity rate going up. Now, let's not connect those two. Those are two true statements. One does not cause the other. More testing does not cause more positive percentage, right? It just makes sure that it just allows us to have more confidence that that 8.8% value we have today is accurate. And so we've seen an increased number of folks getting tested, which is good. Gives us more confidence in the fact that we're seeing the percentage positivity rate going up is accurate and truthful.
Okay, if someone who hasn't been in quarantine wanted to celebrate Thanksgiving with family while wearing a mask, is there a test that a person could take either at a city testing site or at a hospital that could give them accurate results rapidly?
All right, so first of all, I would not recommend anybody go to a hospital to get tested. Hospitals are busy taking care of sick people. Do not go to a hospital to get tested. There are plenty of testing sites available throughout the community. Most of those, the results are going to take 2 to 3 days to get back. So if you wanted to go and get tested, you need to do it today or tomorrow, right? Those are the ones, the PCR tests. There are rapid tests that are available throughout the community. Some places are offering those, but I would warn you that the positive results in those are reliable. There are very few false positives. Most of those positives are very reliable. But unfortunately, in people who don't have any symptoms, the asymptomatic people, there's a fairly respectable false negative rate. So there's rapid tests where you get an answer in 15 to 30 minutes are really only helpful if you get a positive result. If you have no symptoms and you get a negative result, you really should still go on and get another test. And the problem is with Thanksgiving being this Thursday and today is Monday, people are running a little bit short on time.
And what would you say to the person that's planning on taking either antigen, antibody, or PCR test the Wednesday before Thanksgiving?
All right. So first of all, the antibody test tells you whether you had the disease a long time ago. So the antibody tests don't help you at all right now, really. The antigen and the PCR tests look for acute infection. But really the question that you're asking about is the timeline. I think I just kind of answered that. If you want to get one of those tests, you really need to get it done today or tomorrow. And then the other thing is, even if you were to get the test and it's negative, remember, particularly with people who are without symptoms, that one of the problems is that you can get a false negative. And so this graphic here, which I thank God we've got it so handy. So this is a graphic showing if somebody were to become infected on day one, and they are infected on day one, they get exposed, they now have the virus. Remember, for the first 24 to 48 hours, they're probably not going to have any symptoms. And for the first 24 to 48 hours, they may not be spreading it. But even as late as day 5, they could test negative, and that be a false negative because it's so early on since they got infected that they would be negative. And so in this graphic, on day 8 is Thanksgiving. They go and they infect their family members because now by that time they're shedding virus. They still have no symptoms. On day 10, they start feeling a little lousy, got a cough, got a little fever, body ache. They go and get tested. They now come back test positive. They now are at a point where the test will be positive. But unfortunately, 2 days later, they unknowingly and unwittingly, admittedly, but unknowingly potentially infected their family members. So a lot of this is timing. It's not always necessarily intuitive. It's a little bit inconvenient, but these are the facts.
Sorry.
Hi, Mayor, and this is a question for you as well, Dr. Peirce. I was wondering if you could just sort of as an example for people, tell us what you and your families are going to be doing for Thanksgiving this year.
Yeah. So I'll tell you with my family. So in my family, we've not seen our grandchildren since January. So they're going to come over. Everyone's going to stay outside. My wife and I are going to be inside. We're going to be cooking, preparing the meal. We have 2 daughters, one of which is a active public health person, and she's going to be the sheriff. And she doesn't know this yet. And if she's watching, Courtney, you're the sheriff, and your job is to be the masked police and the distancing police. And we're going to celebrate outdoors and do it that way. So it'll be outdoors. Everybody's going to wear a mask, and we've got plenty of room outside in the backyard for us to be able to do it. So that's what we're doing. But quite honestly, that's only because we have not seen our grandchildren since January, because all this time we've been playing by the rules, and I don't think that we're violating the rules. We're going to be very strictly adhering to them, but that's what my family's doing. All right. Mr. Martin?
So our family, my wife and I have 3 kids. Our oldest and his wife are expecting our first grandchild. So we're very concerned about the effects of COVID-19 on a fetus because nobody can give me any data on that. So fortunately for us, he's a doctor in the medical center and he has to work on Thanksgiving Day so that other people that have kids and can experience that with their families can do it. So for us, our oldest son is at University of Texas in Austin, and he came home yesterday, and we required him to get a COVID test before he came home. So my wife we call her the Queen of Corona, like that song, because she does everything by the book. She never goes to a restaurant, never goes out, never does anything. So we're keeping the spirit of social distancing, proper hygiene, and making sure that it's only our immediate family and we know that they're negative. So we're doing the very best that we can, and we hope every other family in the city.
I don't know what we're doing, actually.
Thank you very much.
All right.
Thank you very much for that
Yeah.
profound statement. And for the Turner household, my daughter and I will be attending the Super Feast first. We go there every year. So even though it's being reimagined, we will still start off our morning with the City Bottle Clubs, Bishop Woodard and his group at the Super Feast. And then noon, my daughter will bring over the desserts that she will be making. And then I'm having some food catered. But it's just going to be a very small gathering. And then later on that day, one of my other sisters will be dropping off some food. We're not going to be getting together at my mom's like we would normally get. It will be different. So one sister's going to be dropping off some food. The other is going to be dropping off. And we will say until next year.
So it will be different. There will be no gathering in Acres Home, and my mom and dad's both are deceased, but we always gather in Acres Home. We're not going to do that this time around because we recognize that everyone wants to be safe and want to live to see another day. And so that's exactly what we're going to do.
Thank you all for sharing that. And I have one more question for you, Dr. Purse, about vaccine distribution. You mentioned the health department as being sort of a safety net for vaccines. Could you talk more about what you mean by that? And can people just depend on going to the health department and getting a vaccine? And do you know anything about cost yet? Would it be free?
Yeah, good question. So the cost at this point, we're anticipating there being no cost. The federal government has said they're going to cover the cost, not only for the vaccine, but for the supplies, so the syringes, the swabs, the needles, so on and so forth. There will be a cost, and that we got the manpower that we're going to have to do. I haven't heard the federal government's going to send us any dollars to pay for man hours. So, but in terms of supplies and the vaccine, that should be at no cost. And so, routinely when we have vaccinations, all the routine vaccinations, there are people in our community who don't have a primary care physician, and yet, they need vaccines, or their kids need vaccines for school. And so we fill that role. Now, as this rolls out, and this is going to be evolving, right? So it's very early. So right now we know that the vaccine, as I mentioned, is going to be predominantly going to hospitals and frontline workers. And a lot of this remains to be worked out. But as it starts rolling out, there's more vaccine. It starts getting further and further out in the community. We anticipate it'll be going predominantly to the usual, so the doctor's offices, the clinics, those sorts of places where people who have those resources. But as I said earlier, we know full well that there are people in the community who just don't have access to that, or there are other issues, whether it be transportation or what have you. There are people coming up with challenges that they can't overcome on their own, and it's our job to figure out ways to get them the vaccine that they wanted. And so there's not going to be one single plan for this. We've historically used our multi-service centers and places like in the health department clinics. But if we need to set up a special clinic, we will consider doing that. If we have to come up with mobile vans to go into certain neighborhoods, we'll figure out a way to do that. These aren't things that we haven't done before. We may do them at a scale we've not done before. And there'll be something that's going to come up that nobody thought of. But we'll figure it out and we'll get the job done.
All right, thank you.
And if I can emphasize, just like we learned the first time around with testing, we want to make sure, for example, on testing, we wanted to make sure that testing was provided in vulnerable, at-risk, low-income communities. The same thing with this vaccine. It's important for the city and for us to be advocating and doing everything on our part to make sure that communities and groups that have been disproportionately impacted, low-income, minority communities, communities of color, that they are in the first part of this as much as possible. Because that's where I think we need to focus on where the disproportionate impact has occurred, and make sure that once you get past the healthcare providers and your first responders, that these communities that have been disproportionately impacted, communities of color, low-income communities, that they are right there in the mainstream of distribution. So that has to be very intentional. That has to be a part of the matrix right now at the very beginning as a part of the planning, and not come in on the back end. Otherwise, more people will be impacted and more people will die. So I just want to say that at the very beginning, before one vaccine is disseminated, and it's important for the state. It's important for the state to be in tune with that, to make sure that the distribution, once you get past your healthcare providers and first responders, that these communities of color, where there's been a disproportionate impact, that those vaccines are distributed to those communities at the very beginning.
Hi there,
Yes,
Michael Lopari with KPRC. Mayor, I have two questions for you, but I just wanted to touch up on something Dr. Purse just said. You sort of touched on this in your last answer, but will the city have its own supply then of coronavirus vaccine? And if so, is that coming from the federal government? Is it coming from the state? Will you have to compete with other areas?
A good question. So the vaccine is coming right from the manufacturers. The federal government is working with the states to tell the manufacturers who to send it to. And so this goes on with this prioritization list that the governor put out today. And it is not a completely fleshed out prioritization. What you saw today is really it's priority group 1A. And we don't know how many numbers that's going to go up to yet. So this is, the first pass, identifying those are the front of the line. But I'm sure the governor's office will be fleshing out further priorities as time goes on.
And you sort of touched on,
And to answer your question, so yeah, we fully anticipate receiving vaccine at some point directly from the manufacturer.
thank you. And then you sort of touched on this as well, but in terms of, obviously there's the group of prioritized folks who will get it first. For average people in the community who may not be part of that group, any estimate as to how long down the line it'll be in terms of weeks, months before they are able to get the vaccine?
Good question. Part of that obviously goes to how quickly the manufacturers can produce vaccine. And you've been seeing, in the news that they're talking about millions and millions of doses that they're working on producing. Part of it goes to how quickly it is consumed. So the healthcare workers and how quickly we can get it and how many people take it. I think that there's going to be a pretty high percentage of healthcare workers that are going to take it. I can assure you that none is going to go to waste. There are safeguards in place that none go to waste. Now, when we hear people like Dr. Fauci and others at the federal level talk about when the average person would be able to get it there. I'm hearing April is a common answer to that question, but I would put a little asterisk with that answer because we're gonna have to wait and see, how fast it comes out and how fast it's consumed.
Thank you. And then two questions for the mayor. Mayor, in some communities, the Wednesday before Thanksgiving is traditionally a night that a lot of people go out for drinks or partying. Even though bars technically are not supposed to be open in Harris County, some have transitioned into restaurant service. Right. Are you concerned about big crowds on Wednesday night, and will you order any stepped up enforcement?
Well, and the answer to your question is yes, because there are a number of bars that are now have been classified as restaurants. What I would say, number one is, people also have to be responsible for their own individual behavior. If you walk into any establishment, whether it's a restaurant, whether it's a bar that's now characterized as a restaurant, whether it's any sort of venue, and it's a large crowd, and if it's a large crowd, you ought to turn around and walk out. That's number one. And certainly if you're walking into any sort of place and you see people in there with no mask on, and there's no social distancing, then you need to turn around and walk out. That's number one. Number two, yes, we will be monitoring the situation as much as possible out there to try to enforce to the degree that we can. But it is important for people to exercise individual responsibility. Bear in mind, restaurants now at 75% capacity. So it's hard to distinguish whether you're at 75 or 100%. When you're at 75, who's going to, make that determination that you're beyond your limit? And then now that many of the bars have reclassified as restaurants, that makes it very difficult for our firefighters, police officers, and others who have so much other things that they need to do. So it makes it difficult. And that's why individual responsibility becomes so keenly important.
And then sort of going off of that, final question for you is just about the accountability wall, the wall of shame on the city's website. I checked today, it counted 17 businesses are on there. I just wanted you to reflect, did you feel it ended up being effective or not effective given where we are in the pandemic?
I thought it was, because it came during that time we were in that June period, June, July. So I think all of those measures helped. I think it did have a positive impact. And then let me just say this. Just because a restaurant has the right to go at 75%, there's nothing that says that you have to go at 75%.
Do you think, going back to that though, do you think any of those businesses felt like they were shamed and that it changed any of their behaviors?
I believe that it did. I believe it did, based on the feedback that we were getting, based on the responses that I was getting on social media and the emails that we were receiving. I think it did have a positive impact. And then I think what added to that, and let me thank the media, just the fact that you all reported on it. That, I believe it did have a positive impact. So I think it's a combination of things. I think when people are hearing the numbers and the number of people in hospitals, okay, I think all of it in combination. I don't think it's any one thing, but I think it's a combination of factors. And I still want to believe that if you provide people with the information, and don't try to sanitize it, just provide it to people, provide the information to people. I think people will exercise their common judgment and they're smart enough to say, okay, we got it. I would like to think that.
Dr. Pence, my question is to you. We are very happy to hear of the vaccine and vaccine, but I want you to speak to why do we hear this issue of mRNA vaccine, and how different is it from the different vaccine process and production which has happened before? And why are they talking about a synthetic, chemically produced vaccine and the need for caution? Because I'm sure the population wants to hear from you why that need for caution.
Okay, thanks. That's a great question. So the mRNA technology is a new technology for vaccine production. Now, a lot of the traditional vaccine techniques are being used with some of the other manufacturers, but the mRNA is a messenger RNA, and so a little bit of biology. So, DNA, it's a double-stranded, RNA is single-stranded. It's a series of amino acids that are basically, it's like a genetic code. Think of it almost like a barcode for your cells. It's a series of amino acids when in a particular order tell your cells to do something. And so with this mRNA vaccine, it basically functions almost in its own right, almost like a little mini virus. But what it tells the cell to do is to produce the proteins that look just exactly like the spike protein on the surface of the coronavirus. And so as your cells start producing millions of copies of the spike protein, your immune system recognizes that that is not supposed to be here. This is something new. This is not part of me. This is not supposed to be here. And it mounts a reaction to get rid of that. So then if you should later become infected with the coronavirus that has those same spike proteins on the outside, your immune system will recognize that that's not supposed to be here. And then the cascade begins and all the immune steps of the immune system, so that then the coronavirus gets destroyed by your immune system only because it has a spike protein on it that you already told your immune system that anything that has this spike protein on it, destroy it. So the messenger RNA is, it's a new technology. It's actually relatively brilliant. It is done, as you said, synthetically. So there's no other animal proteins. And sometimes when we get allergic reactions to viruses and other medications, quite honestly, it's because some of those have other animal proteins that our immune system gets, we have an allergic reaction, so there's much less risk for it. So it's quite brilliant, this new technology. And the fact that we can do it is because of all the advances in genome sequencing, which started, decade or two ago. And we have now got to the point where we can actually create a messenger RNA system or a messenger RNA to tell your cells to start producing a particular protein to teach your immune system to seek and destroy if you ever see it again.
I think I understood more when Chief Pena was talking in Spanish than I understood the dialogue between the two of you, which means press conference is over.
I'm gonna take that as a compliment.
It was quite good.
Yeah,
Like
it sounded plausible.
I see it coming and I'm gonna shoot it and kill it.
Hold on. Sorry, hold on. Before we do that.
Yeah. Let me just say happy Thanksgiving to everyone. I think it's Feliz Dia de Favo. You got it. Happy Thanksgiving. Happy Thanksgiving. Okay.